Imagine you're home alone when suddenly your chest tightens, your arm goes numb, and breathing feels impossible. What would you do? Every year, over 380,000 seniors face this terrifying moment, completely alone. But here's the shocking truth. Knowing exactly what to do in the first 60 seconds can increase your survival chances by 73%. In this powerful video, we reveal 7 scientifically proven, doctor-proved techniques that could save your life even before help arrives. Backed by research from Harvard, Johns Hopkins, and Mayo Clinic, these aren't myths or internet tricks. They're real, evidence-based actions that give you precious extra minutes when every heartbeat counts. What you'll learn: how to create an emergency communication system that actually works, the correct way to perform Cough CPR safely and effectively, the aspirin protocol that speeds absorption by 50%, the best body position to keep blood flowing and oxygen high, a breathing method proven to reduce heart damage by 45%, the door unlock and signal protocol that can save up to 11 minutes of rescue time, the nitroglycerin protocol used by cardiologists to cut heart damage in half. Why this matters: heart attacks don't wait, and most happen when you least expect it. Learn these techniques now, practice them before you need them, and share this knowledge with your loved ones. Because preparation isn't fear, it's power. Support our mission. If this video helps you, please like, share, and subscribe. It helps our message reach more seniors who need it most. Leave a comment. Have you ever experienced or witnessed a heart emergency alone? Your story could save someone's life. Support our channel with a small donation, or buy me a coffee. Every contribution helps us create more life-saving senior health videos. Together, we can keep hearts beating stronger and longer. I want to talk about 3 critical, yet simple, steps that could make the difference in a heart emergency. This isn't about fear, it's about empowerment and preparation. Think of this as your personal emergency safety training. 7. Create your lifeline, the emergency communication system when a heart emergency strikes. Time is everything. We know that oxygen loss can impair memory in seconds. Staggering 7% of survivors couldn't recall their own address when calling 911. Let's make sure that doesn't happen to you. Make your information unforgettable. Write your full address, phone number, and any special entry instructions on bright, clear index cards. Place one right next to every single phone in your home. Speed is safety. Program 911 as speed dial number 1 on all your phones. Keep your tools handy. The hours between 10 p.m. and 6 a.m. are critical, accounting for 43% of fatal heart attacks, often when phones are out of reach. Keep your phone charged and nearby on your nightstand. For example, wear your watch. A third of people weren't wearing their medical alert device when they needed it. If you have one, make it a habit. Wear your waterproof medical alert device at all times. Build your support network. Inform your trusted neighbors or building manager. Give a spare key or access instructions to people who can check on you quickly. 6. The conscious guard, mastering Cough CPR. While this technique is absolutely not a substitute for calling 911, it's an important tool to know. In the very early stages of a heart rhythm problem, an arrhythmia, if you are still conscious, a forceful cough can help maintain blood flow until help arrives. A study at Ping Union Medical College showed that patients who used this technique correctly stayed conscious, an average of 92 seconds longer. The technique: take a deep breath, then cough forcefully and deeply from your diaphragm like you're trying to bring up phlegm every 2 seconds. When to use it: only use this while you are fully conscious and are experiencing the first symptoms of an arrhythmia. A quick note: it's most effective in the first 30 to 60 seconds and is simply buying precious time. Call 911 first, then use this technique while waiting. 5. The clot buster, the correct aspirin protocol if you are experiencing chest pain or signs of a heart attack and are not allergic or taking strong blood thinners. Please always check with your personal doctor. Aspirin is a vital step. Its purpose is to prevent a blood clot from growing and potentially restore blood flow. The evidence is powerful. Taking aspirin within the first hour can reduce death rates by 23%. The secret to its speed is how you take it. The crucial step: chew, don't swallow. Chewing the tablet allows the medication to absorb much faster through the tissues in your mouth. You see, San Diego found that chewed aspirin works in 14 minutes versus 26 minutes for swallowed. The dose: The proper dose is 325 mg, 1 regular strength tablet, or 4 baby aspirins. Yes, take the full dose. Even if you take a daily 81 mg baby aspirin, take the full 325 mg dose during an emergency. Stocking up. Keep non-coated tablets in a few accessible locations, and please, check the expiration date every 6 months. 4. Assume the cardiac position. When heart trouble strikes, your position matters immediately. Research from organizations like the European Resuscitation Council shows that proper positioning can extend the time you remain conscious by up to 40%. The technique: sit up, don't lie down. Unless you feel you are about to faint, sit up at a $MATH/BFY circ dollar angle, known as the semi-Fowler's position. You can do this by propping yourself up with pillows or sitting on the edge of a bed or chair with your knees bent and feet flat. This posture helps ease the strain on your heart and makes breathing easier. Loosen your clothing. Quickly loosen any tight clothing around your neck or chest. Studies in the Journal of Cardiac Nursing show this simple step can improve your oxygen levels by up to $8 %. More oxygen means less stress on your heart. If fainting is imminent, if you feel you are about to pass out, lie on your side in the recovery position. This is vital to keep your airway open and prevent choking on saliva or vomit. Control the environment, if possible. Ensure the room is cool and well ventilated. Overheating forces your heart to work harder. 3. Controlled breathing method. In an emergency, panic is natural, but it leads to hyperventilation, which actually worsens the oxygen flow your body desperately needs. The good news is you can train yourself to override this. A Stanford University Medical Center study found that controlled breathing techniques reduced heart muscle damage by $MATH/BF 45% during a cardiac event. The technique, the 4-4-6 method. This focused breathing regulates your nervous system. Inhale slowly through your nose for a $MATH/BF 4 count. Hold your breath for a $MATH/BF 4 count. Exhale slowly through pursed lips for a $MATH/BF 6 count. Focus on diaphragm belly breathing. Ensure your abdomen, not your chest, is rising. The benefits. The Mayo Clinic notes this method can immediately lower your heart rate by $MATH/BF 10 to $15 beats per minute (BPM), reduce blood pressure, and help prevent painful coronary artery spasms. Practice is key. The American Journal of Cardiology found that individuals who practiced controlled breathing daily succeeded in using the technique 78% of the time during an emergency. Make it a daily habit. Call 911 while breathing. Try to count aloud. This subtle action is a clear signal to the dispatcher that you are conscious and allows them to better assist you. Point 2. Emergency door unlock and signal protocol. Once you've managed your immediate symptoms, your very next thought must be, how will first responders get to me? Locked doors are a critical and often overlooked barrier. Data shows locked doors delay treatment by an average of 11 minutes and are associated with $34% of cardiac deaths in seniors. Your first action: unlock the door. The University of Pennsylvania found that simply unlocking your main entrance door as the absolute first step dramatically improves survival rates by $MATH/BF 47%. Don't wait until you're 2 weak. Protocol for a faster response. Key lockbox registration. Consider registering a key lockbox like the ones realtors use with your local fire department. This can save responders approximately $MATH/BF 8 minutes. Light the way. Turn on all lights in your home to provide a clear, visible signal to paramedics. Signal from outside. If it's daylight, hang a bright towel or object from a door handle or window. Apartment dwellers. If you live in a building, also call security or the front desk. Having staff escort the paramedics can reduce delay by about $MATH/BF 6 minutes. Emergency info sheet. Keep a laminated emergency information sheet listing medical conditions, medications, and allergies taped inside your door or on the refrigerator. Also, keep a whistle nearby to signal your location. Smart technology. If you have a smart lock, explore options that allow it to auto-unlock when you call 911. The Cleveland Clinic found this can improve response time by $31%. The immediate nitroglycerin protocol, your most critical tool of all. The steps we can take. None is more immediately impactful than the correct use of nitroglycerin. A major study, including research from Harvard, highlighted just how vital this is. Using your prescribed nitroglycerin correctly within 3 minutes of chest pain can result in a survival rate almost equal to having paramedics instantly at your side. This buys you precious time. How nitroglycerin works. Nitroglycerin is a powerhouse because it dilates blood vessels, meaning it widens them. This action rapidly eases the strain on your heart and significantly improves blood flow past any partial blockages. Clinical evidence published in the BMJ across a trial of 12,000 patients showed that early use can reduce mortality by about 35% and limit heart muscle damage by up to 50%. The life-saving steps. It's vital that you practice this protocol in your mind now, while you are calm. Sit down immediately. This is non-negotiable. Never take nitroglycerin while standing. Sitting lowers your blood pressure and prevents a fall should you feel lightheaded. Take the first dose. Place 1 tablet directly under your tongue. This is a sublingual medication, so it must be absorbed through the tissue. There, do not swallow it. Wait and assess. Wait 5 minutes. If the chest pain or discomfort hasn't started to ease, take a second tablet under your tongue. Call for help. If you still have pain 5 minutes after the second tablet, take a third tablet. The hard limit: never exceed 3 tablets within a 15-minute period. Combined with aspirin, for maximum benefit. The evidence is clear. Chew 1 full-dose aspirin immediately alongside your first dose of nitroglycerin. Research from Johns Hopkins shows that this combination can boost survival rates by an additional 58%. Chewing it allows for much faster absorption. Storage and safety: to ensure your medication works when you need it, always keep it in its original amber glass bottle. It's sensitive to heat and light, so keep it in cool, dry spots, not in a hot car or a steamy bathroom cabinet. Replace your supply every 6 months, as it loses potency over time. Critical warning: never combine nitroglycerin with erectile dysfunction medications like Viagra, Cialis, or Levitra. This combination can cause a fatal, sudden drop in blood pressure. Conclusion and final tips. Knowledge is survival. These steps, especially the nitroglycerin protocol, are designed to buy you critical time. The average US paramedic response time is between 8 and 12 minutes. Preparation is key. Don't wait until an emergency to figure this out. Practice daily. Simple, mindful breathing exercises can help you stay calm during a stressful event. Monthly checks. Take a moment to check your medication dates and ensure your emergency contact lists are up to date and visible. Visible instructions. Keep a simple, printed set of these steps near your medication or phone. I truly believe that knowledge plus preparation equals survival. This information is vital, especially for our seniors and those who care for them. If you found this advice helpful, please like this video and share it with your family and friends. A few clicks could be the difference between life and death for someone you care about. Thank you for taking your health seriously. Be well.